Since we'll be discussing the ins and outs of CAR T cell therapy, I thought we could start with your perspective as a researcher in the field. How has this therapy revolutionized myeloma care?
It absolutely has. And I would say in time, this is now our fourth revolution. Stem cell transplants was the first time we actually achieved what we call a complete remission in at least a few patients, making myeloma disappear. Then we had the second revolution with the novel agents. Now we had drug therapies that were giving us these complete remissions, still at about a 30% rate. And then the monoclonal antibodies were the most recent revolution. And currently we are in what we call the T-cell redirection. And it really has been driven by CAR T-cell therapies and something we call bispecific antibodies, which also use your patient's T-cells to kill the myeloma. And we are now seeing absolutely unprecedented response rates, meaning almost everybody is responding, and also depth of response, which we've really learned over time is a way to translate into long remissions. So very long, very significant remissions, and the early data in patients who've had many prior lines.
Mm-hmm. So it's very encouraging news.
It is very encouraging.
Let's start with an overview of CAR T cell therapy. Could you explain how the treatment works?
Absolutely. So CAR T specifically is speaking to T cells, which are a normal part of the immune system that have been engineered and modified. So normal part of the immune system, T cells, have a lot of checks and balances and are constantly looking for cells that are supposed to be killed. For example, something that has a virus in it. When we engineer the CAR T cells, we modify the target. So they are now trained to find the specific target on a tumor cell. And we remove all these checks and balances. So once that T cell finds its target, it can kill it without all of the side effects. The way normal T cells communicate with other members of the immune system are something called cytokines. So we'll touch on that a little later, I think, but we also, again, interfere with that communication by engineering the cells.
Which patient type qualifies for CAR T?
In 2023, we currently have 2 approved commercial CAR T products, and we do have a number of them in clinical trials. The 2 that are commercially approved specifically are targeted for patients who are in their 4th line of therapy. So the myeloma has learned to come back that 4 times. They've been exposed to sort of all the regular drugs, which by 4 lines, most patients will have been at least once. We look for patients whose kidney function is at a safe level to tolerate the therapy. And other than that, it's really having caregiver support and overall ability to come to a center that specializes in this.